Good morning and welcome to the webinar. My name is Sudha Tambaswamy and I'm a broker advisor at Cornerstone. Today I'm joined by our representative from Anthem Indiana for a review of his fourth quarter and 2024 updates. If you have any questions throughout the presentation, you can leave them in the question box on your GoToWebinar dashboard. We will address all questions at the end of the webinar. My information is on the screen if you'd like to get in contact with me, and don't forget to follow us on social media and subscribe to our weekly Monday Minute newsletter. We keep you in the know with any industry and Cornerstone updates and information. Contact your Cornerstone broker advisor if you are not currently subscribed. The AGB Broker Portal is your one-stop shop for managing your book of business through Cornerstone, from carrier and client information to commission schedules. If you have any questions about the platform and your access, please reach out to your broker advisor or the AGB support team at agbsupport@cornerstone.com. With Cornerstone's agency services program, you are the pilot of your business and we are the flight crew. As a Cornerstone broker, you have access to expert services from our agency services program that can help you with business outside of your scope and planning for the future. We will create a customized plan for you based on your specific needs to ensure that you, your business, and your family are covered. Contact your Cornerstone representative for more information. And now I'm going to toss it over to our representative from Anthem, Indiana, Arnold Saunders, for his fourth quarter updates.
Thank you, Sudha, and good morning, everybody. My name is Arnold Saunders. Everyone calls me Arnie, and I am the sales rep for Anthem Blue Cross Blue Shield and the Southern Indiana, and Ohio brokers that have Indiana business as well. They are also in my territory. So nice to see you all, or nice to have you all on here rather, and have you present for this presentation. We're gonna go over a few things here for the Anthem Indiana 2024 updates, and all the updates we'll have will be in the order of individual first, and then small group next, and then of course if you have questions at the end, then we can go from there as well. So quickly, once again, here's the agenda, and we'll get started. The January 2024 small group renewals will be released around the 15th of this month. So by the end of this week, we expect them to be out. So far, looking pretty good. Without any kind of individual details of each group, we don't have that yet as far as what the renewals are going to look like yet. We get a opportunity to get an idea of what Anthem filed with the state, and they looked the renewal increases or adjustments that we filed were competitive once again this year. The January quoting, so you can quote for January now. As of the first week of this month, we were able to start quoting for January 1 business. Now with Anthem Indiana, I'm not sure how it is in Ohio, but once you can quote the first month of a quarter, you can quote that entire quarter. So what this is basically saying is the first quarter of Anthem Indiana business can now be quoted. So you can quote for January, but also February and March as well right now. Few changes that you probably are already aware of, but the parent company for Anthem is now Elevance Health. So Elevance Health, Elevance meaning to elevate and advance, and they combined those two words together and came up with Elevance after several meetings of what to name the parent company. This is the holding company's name, basically. Elevance Health, but in the marketplace will still be known as Anthem to all the general market that we work in this capacity. And we also changed the font, if you will, or the logo for Anthem Blue Cross Blue Shield. We've always been with the font on the left bottom, that blue, Anthem Blue Cross Blue Shield. Well, now the new font is on the right-hand side there for Anthem Blue Cross Blue Shield. That's also an update that we had, transitioning and making moves, making changes to that logo, but still keeping that same name in the marketplace, even though our parent company is now called Elevance Health. Still the same Anthem that you know, but always improving. We often have a lot of emphasis on how we are so important and so local in our markets. Like, people have a lot of importance on Blue Cross Blue Shield and that brand name and what that means to the individual families that we touch in our local markets, which is very important to us. As individual sales reps and small group sales reps and large group sales reps, we take a lot of pride in the fact that we are well entrenched in our local markets. But Anthem is also huge. So Elevance Health is also a big company. Blue Cross Blue Shield is a very well-known brand throughout the entire country and even the world. There are more than 4.7 million members that are Blue Cross Blue Shield members in Indiana. Nationally, we have 47.5 million members. We have 5,520 Anthem associates that live and work in Indiana, and we've been serving Indiana for 79 years. So Anthem's been around for a long time. Blue Cross Blue Shield's been around for a long time. We're a large company, but we act locally as well. We put our stamp on our local markets as well, but we keep in mind that we're also a large company, and that comes in handy when we're looking at negotiating with our providers and getting discounts and having a good relationship with those providers and working for the best prices that we can possible in those negotiations, those contract negotiations with those providers, because they know we have a lot of membership, and that can work to our effort to kind of get some leverage to get those costs down nationally. And that's one of the focuses that we have going on nationally, as well as getting the cost of care down. This is the overall Indiana team. I am down the right bottom corner there in that teal color, in the area around the Cincinnati area and over west of that, over in Morgan, Monroe, and Lawrence County. Any of you that have business in Indiana, though, wherever you are in Ohio, Columbus, Cincinnati, Dayton, or whatever, if you're in Ohio and you have Indiana business, you will work through me for individual and small group. But the rest of our team is very capable as well. This just gives you an idea of who we all are. The small group and the business team is the only one in the country that has a team such as this that works on implementation. So when your new cases come in, these are the people who take the cases and work with them. And we also have a dedicated quoter as well, who also quotes groups for you through quickquote@anthem.com, the email address that is oftentimes used for ACA quotes. We have all that, these people on that team for implementation for your new cases and for quoting if need be, but not quoting for MEWA, by the way. This is your overall team. Once again, this is everyone who I showed on the map, and including the new implementation, the new business or implementation team. We have over 235 years of experience at Anthem in Indiana. And also here in Indiana, well, actually, this is actually national. We've had some legislative updates that I want to make you aware of as well. There is a plan we have in the market called the Anthem Enhanced Choice Plan, the AEC, and you have it also in Ohio. In Ohio, I believe you are already at a 3-month duration for that Anthem Enhanced Choice or that limited duration plan. In Indiana, we were able to sell that plan for with a 3-year duration, 364. I'm sorry, for 36 for 3-year term. And then you had to reapply as and be re-underwritten for that Anthem Enhanced Choice Plan. That was our difference that we had, whereas Ohio did not have that. It's only 3 months. Well, now nationally, the ruling has come out that you cannot have a limited duration plan for longer than 364 days, which is basically 3 months. I'm sorry. You can't have a limited duration plan for longer than 3 months with a maximum of 4 months because there's a 1 month grace period. So we were able to keep a plan in place for 3 years in the past. Now we can't do that any longer. It now must be 3 months, like Ohio already had theirs. And this is a national ruling that came out, or that will be coming out the first quarter of 2024. And so anyone who has members on our Anthem Enhanced Choice plans, which is the 3-year limited duration plan, they can continue on that plan through the end of that term. And it will not be continued, be able to be continued with that term in place. In other words, they can't renew in another 3-year term like we were selling before. They would have to go into the 3-month maximum time frame. That's going to be the law of the land for those limited duration plans going forward. So no longer 3 years in Indiana, it'll only be 3 months, and with a 4th month there to allow for the transition or for them to renew and find a different plan. So it'll be a total of 4 months, but the duration is truly a 3-month plan now going forward. There is a lot of information in the omnibus plan that was passed, the Consolidated Appropriations Act. We have a toolkit here that will allow you to break down that Consolidated Act and to see what Anthem has for you to help you understand or help your clients understand what was in that act. And this toolkit here is on the link that you have here for Producer's Response or producerresponse.com. You can have that wide, vast bill that was passed broken down into the elements that may be important for you and your agency or you and your client. So we will make you aware of that as well. These are the IRS guidelines for the HSA qualified plans for individual plans for 2024. It shows you what the plans were, or what the guidelines were rather, for the minimum deductible and max out-of-pocket deductible, max out-of-pocket maximum rather, for individuals in 2022, 2023, and what they will be in 2024. This has the embedded deductibles and out-of-pocket maximums and the non-embedded as well. ACA limits for maximum out-of-pocket for ACA non-HSA plans that are embedded. The individual deductible, the individual out-of-pocket max is $9,100, and then for the maximum out-of-pocket limits for family, $18,200 for 2023. I'm going to move this over here so I can see what it's going to be for 2024. Okay. And for 2024, $9,450 for 2024, and $18,900 for family in 2024. So a slight increase from 2023 to 2024, which is usually the case for these kinds of changes that we have. Usually aren't too huge, and there's not the case as well for this year. One of the big pushes that we have for individual this year is the Medicaid Redetermination. With a lot of people who were able to come on the Medicaid plans due to the pandemic, they were a little bit more lenient in what they allowed for people, or what they for the guidelines that they have for people to qualify for Medicaid. And now that they're getting back to the original rules or the stricter rules, people are coming off or being forced off of Medicaid. And some people will choose to select a different plan. Some will choose not to have a different plan, just go with no coverage at all. Of course, some will just remain on Medicaid. But for those who are coming off their Medicaid plans and are seeking other coverage, Anthem is making it very clear that we're open for those people to come onto an Anthem individual plan. There are a lot of ACA options. We have some $0 monthly premium options, and we're making you aware of the fact that Anthem is open for business for that. So this just shows you, I guess it gives you an idea of Indiana's Medicaid membership. You can see how it's increased during that 2020, 2021, 2022 timeframe, and now it's coming back down again. So as people are coming off those plans, I think in Indiana we got like 26,000 people per month through the end of this year will be coming off of Medicaid and will be seeking a new plan. So a lot of opportunity there for that. For individual plans for 2024, big things we want you to take away is that we've got, once again, I've mentioned earlier, we've got health coverage as low as $0 in premiums for some Anthem plans. We've got, of course, the preventive care benefits that are part of the plan, and $0 virtual care as well. A lot more emphasis on virtual care these days. So we have those plans that are included with our Sydney app for individual clients. And there are also $0 commonly used prescription drugs as well. So a lot of things to look forward to for the individual side of things. People coming off of their Medicaid plans, or just people in general who are looking for a different alternative to their current plan designs in Indiana. Anthem Individual is one you want to take a look at for sure. This is the Anthem Enhanced Choice plan design I mentioned earlier. That's going from a 3-year plan to a 3-month plan. We're looking at the network here. The network for that plan, if anyone wants to have a plan that's just that's going to be for 3 months, that's the Pathway X network that we use for that plan. And it's for the Anthem Enhanced Choice only. So you'll see when you're looking at the network, it'll say Pathway X for that network. Contrast that with our ACA plan that's on exchange. That network is the Pathway Essentials network. Pathway Essentials has just been expanded. I'll show you a map here shortly that shows you where those providers are in that network. But it was very focused on certain parts of the state, and now it's expanded more into the larger portion of the state. The Pathway Essentials, once again, is the name you want to look for the providers in that network. It's primarily Indiana University Health, or IU Health as we call it here. IU Health is the main provider in that network. And the RX network that we use for that is called RX Choice. Once again, anyone who's on the ACA plans, the individual ACA plans, you're looking at the Pathway Essentials network. For 2024, the Anthem network has expanded. Once again, Pathway Essentials network has expanded to 95% of the counties in Indiana, 87 out of 92 counties in Indiana. And for 2024, we filed for a 1% decrease with the individual plan, the individual ACA on exchange plan, 1% decrease this year. So the low cost leader in 15 of the state 17 regions that we have here. We're not offering it in region 14. And that's the second lowest. We have the second lowest cost in region 17, which is in Evansville, with our bronze plans. Silver plan, Anthem is a low cost leader in 12 of the state 17 regions. Still not offering also in region 14. You'll see that's actually the region over by Cincinnati, and the second lowest cost in the remaining four regions as well with our silver plans. And here it is. So, of course, in the Cincy area, around the Cincinnati area, that is region 14, where Anthem is not, the Anthem Essentials, or Pathway Essentials network is not in that area. It's Franklin County, Ripley County, Dearborn, Ohio, and Switzerland is right in this Cincinnati area. So it's not in that area. But for those of you who have individual clients that are throughout the rest of the parts of the state, you can see those areas are covered in blue. The further away you get from Cincinnati area, the more you have a chance of being in an area where you can sell the Pathway Essentials plan, or which is actually our individual ACA on exchange plan. There's some changes here for the individual plans that we have coming up. You can see here that there are no new plans for 2024, and this the changes that are taking place with the plans that we have in that are being discontinued, and then the new plans for 2024 as well. Few more changes here, updates for our individual plans from 2022, 2023 to 2024. Some decreases in the deductibles, and some increases in out-of-pocket maximums, just various changes from one year to the next. We have those, annually have these changes for individual plans. More changes here for individual plans, in our bronze, silver, and gold plans that we have. Increases and decreases for 2023 and 2024. One thing to mention here to you is that our individual members have an engagement package as well. So members and their spouses and domestic partners will have access to the rewards that are being offered. For example, a member can earn or eligible to receive $45 per plan. The members can earn $25 for visiting their doctor for an annual wellness or well woman exam within the first 90 days when their plan begins, and $20 for completing the digital health assessment. So these will come in the form of a digital MasterCard or Amazon or Target or Uber card, TJ Maxx, Home Depot, Gap stores, Apple stores. There's a wide range of cards you can get that reimbursement from. Only the digital MasterCard can be converted to physically mailed card. And rewards should be redeemed before the end of the current plan year. So just make sure that your individual clients also know that they have access to these engagement packages as well. Included in the plan benefits is pediatric, dental, and vision for the individual plans, of course. No cost visits for preventive care services and online doctor visits. And they are also nationally for emergency and urgent care, there will be a part of the Blue Card network. So for our PPO plans that are on small group, for example, they're all a part of the Blue Card network. But for individual, because it's an HMO, HMOs are not part of the Blue Card network. Of course, when you have an emergency or urgent care situation, the services are going to be considered in network. So that puts those services for even our individual clients, our individual members, they'll be using that Blue Card for those services. Of course, you don't want to be using emergency and urgent care when you're traveling or outside the state, but just know that it's there when you are a member of Blue Cross Blue Shield through our individual programs. There's also international access to the Blue Cross Blue Shield Global Care program as well. So they also have international access, international coverage through the individual plans. And special offers are also available to the individual members, which is like ProClear aligners and LASIK network and or LASIK network, Fitbits, Garmin, and the things you see here as well. So in other words, it's a wide range of options for individual members. They're not cut out because they're on an individual plan. They have access to a lot of things that Anthem offers in general for all of our members. There are two ways to fill your prescriptions. Of course, there's retail, and then there's home delivery. And retail, we have the level 1 and level 2 pharmacies. In Indiana, level 1 pharmacies will be CVS, Walmart, and Kroger primarily. And level 2 will be Walgreens, Costco, Sam's Club, Rite Aid, Meijer. What that is level 1 means you're going to pay less than level 2. So if you go to a level 1 pharmacy like CVS, for example, or Walmart or Kroger, you're going to pay, in 2023, it was $10 or 10% less. But in 2024, it will be $15 or 15% less. So $15 less if it's a copay for the prescription, 15% less than level 2 pharmacies if it's a co-insurance arrangement that you have or benefit that you have for your prescription medications. And then with the mail order, of course, it's home delivery, and you'll have cost savings by using the home delivery. Our pharmacy is called Carillon now. In the years past, it had been called Ingenio. Now Ingenio is now Carillon. That's the individual update. We are now moving to the small group update here for Indiana. Of course, in Indiana now we have a wide range of products that we offer, from the ACA, which is not underwritten, to the Anthem Balanced Funding Plan, which is underwritten as a level funded plan. And so for the which we call the ABF is what we also call the Anthem Balanced Funding Plan. So ABF is our preferred risk plan along with the MEWA. So MEWA and ABF are kind of side by side here. They're the ones that are more sensitive to the conditions in the group because they are underwritten. And so they're both open for new sales, but the MEWA, you have to join a chamber of commerce to be able to offer and sell the MEWA. Both your agency must be a member of the Indiana or Indy Chamber, and the group or the client themselves must also be, or the employer must be, a member of the chamber, either one of the two. Indy Chamber is only for the groups located in Indianapolis or the Marion County, and the surrounding counties around Marion County can choose either one, Indiana or Indy Chamber. The rest of the state is all Indiana Chamber. So anywhere outside of Indianapolis, that central area, they must choose the Indiana Chamber. We have associations and PEOs that we are also a part of. That would be a separate issue. We go into that as an individual case there, because those are not that common, but we do offer associations and PEOs outside of the MEWA, which is also an association. Legacy plans you can't write for new business, but you can still maintain those plans and keep those going. Main thing for the legacy, to keep the groups on those legacy plans, is the drug card is the national formulary. The national formulary you cannot find anywhere else in the marketplace. It's an open formulary. If the drug is not listed, it may still be covered. You just don't find that anywhere else anymore. So most of the plans are closed formularies now, where you have to get an exception for every drug that's not listed on the formulary. Not so for the national formulary, which is what the legacy has. So that's worth its weight in gold all by itself. If a group is on a legacy plan and they want to stay on that legacy plan, it may make sense for most of the groups, for a lot of the groups, to actually do that. And of course, ACA is the community rated plans where there's no underwriting at all. So those plans are still very, very viable and very active. We're selling a lot of ACA and a lot of MEWA these days. PEO, as I mentioned earlier, we deal mainly with human capital concepts. Increasingly, a little bit more of ADP is coming around as well. They have a broker referral program that they have to include you in order to sell the ADP plan. Human capital concepts is basically anyone can bring a client to them and sell it, if that group is open to all the conditions and requirements of being a part of that PEO. Associations, if you have any groups that are like libraries or town of or city of, any municipalities, water treatment plants, those kind of employers, sometimes they just simply want to be a part of an organization with other employers like them. They may be slightly more than the MEWA, maybe the same as the MEWA or the ABF, but they may still want to be a part of the IPEP, as we call it, program. And so if you have any clients that are municipalities, public employees, talk to me about that. We can get that set up and get some quotes out to them. Once again, it's not always the lowest cost option, but sometimes it will be a fit, and they can be a long-term client of IPEP as well, and won't look to move to go anywhere else because they're satisfied being in that organization. Indiana Employers Trust is a little bit more of a specified association. They have specific SIC codes that they will accept into that trust, but it too is a good option for some clients as well. ACA highlights, we had a 6.3% increase for 2024 that we filed, and our competitors have all filed for a higher rate increase in 2024. So look for Anthem to be very competitive in the ACA small group market. So those of you who are used to quoting Anthem's ACA here in Indiana, keep doing so. I think you'll see the benefit, the strength that we have with that ACA product. The MEWA highlights for Indiana, overall, the MEWA, once they get in the MEWA, they don't usually move. We've gotten a few requests for termination here in Indiana recently, and it's kind of weird. It's like, what do we do? We don't get that many terminations for the MEWA. We just simply don't. More than 9 out of 10 groups renew with the MEWA here in Indiana. So that's been good. And the renewal increase for that we sent out for, or that we filed for 2023 in October was 7.2%. So we're still keeping that under that double-digit increase range. We've got many members. Average employee size is 8. Average membership size, when you include the subscriber or the spouses and dependents and children and everything combined, average membership size is about 15. So we're not looking at huge groups, but this definitely 2 to 50 is that range. If they go below 2, it's not going to work, just to have the 1. If they go over 50, they have to be moved to large groups. So we're looking at strictly 2 to 50, but it is a very vibrant and active plan design that we have here with that MEWA. That's been a really popular plan. And also, let me also say, for the MEWA, you also get medical discounts by adding specialty. So if you add dental and vision, you can get you will get a discount on the medical by adding specialty to it as well. Anthem balanced funding. So this is the level funded plan that Anthem offers. The minimum group size for this is 10, and the maximum is 50. So MEWA was 2 to 50. The ABF is 10 to 50. $20,000 specific stop loss. So that's just going to be for your and your individual employees. 110% aggregate stop loss, and there's also a chance or opportunity for a refund, a surplus refund as well. So we are looking to get more activity with this Anthem Balanced Funding Plan. And the first thing you'll do, however, though, if you quote this and you want to get a ABF, as we call them, quote, the first thing you'll do when you go online is you'll quote the MEWA. So if you forward it, if you upload everything and submit everything for the MEWA, and you want to see what the ABF looks like, then you contact me, and I'll take it from that point on. A lot of times here in Indiana right now, the MEWA still is the more, there's more opportunity for the client to take the MEWA than it is to take them for the Anthem Balanced Funding right now, because of the restrictions we have in underwriting for the kind of groups would take for the ABF right now. That probably will be changing in 2024. More details will come out later on that. So it is available. It works great for some groups, and it'll probably be more readily available and a more clear option for groups as time goes on. But right now, what's happening is the MEWA is eating the business that would go to Anthem Balanced Funding if the MEWA wasn't so strong. So good thing for the MEWA, but it is available for groups to take a look at if they so choose. Small group highlights. All HSA plans will waive the deductible for virtual visits through Life Health Online and K-Health. K-Health is the chat service with the provider, the medical provider. Those, and Life Health Online is the actual virtual visit where you're doing the screen time with the provider. So those will have deductibles waived for the HSA plans in 2024. Mail order drugs will have reduced member cost sharing due to a reduction in retail copay multipliers. So you'll see a decrease in the cost for your mail order prescriptions. And I'll go over that in more detail here shortly. New ACA, MEWA, ABF, HSA plans with preventive RX Plus benefits with low copays, no deductible, for Tier 1 and Tier 2 drugs for common chronic conditions. We'll go over that certainly in a few more slides here. And new lower cost MEWA ABF plans with lean RX benefits with new low copays. So we'll go over that also here shortly. Indiana Small Group ACA portfolio designs. Here's details on that. We're using the Blue Access Network for ACA, and there's also HealthSync HMO plans that are available. HealthSync, however, is not that broad of a network in the area around Ohio, more in the central Indiana area. So I don't sell a lot of the brokers that I have in my territory. So that teal area where I operate mainly, there's not a lot of activity for the HealthSync network right now. Mainly everybody's writing a Blue Access. This is also true for this MEWA portfolio design as well. So for ACA, MEWA, ABF, the main driver is the PPO Blue Access network by far. HealthSync network is expanding, but it is an HMO network. So if you go outside the network, it's no coverage. We do have that new 3-tier HMO product, which is actually a POS, which is you use the HealthSync network, HMO network for the best services on the best benefits in that plan design. Then if there's no HMO provider that you use, you then go to the PPO network, which is the Blue Access. And then there's also out of network benefits. We do have a 3-tier network like that now in Indiana, but you must be in an area where the HealthSync provider actually is, where there's actually a HealthSync provider. So if you're not in an area where you can even sell HealthSync, you can't sell the 3-tier product either that has the PPO and out of network benefits. So because of that, the main driver for the territory that I deal with, and probably most of you deal with, you're going to be looking at Blue Access network on these plans. So what we're looking at here is just the various plans that are going to be available for 2024 here in the networks that they're in. And at the bottom of the page, it mentions once again that preventive RX and lean RX, and we'll go over into more of that here shortly as well. These are the new plans we're offering in 2024 for the small group ACA plans, and it also shows here the discontinued plans that were available in 2023. These are the MEWA plans that are going to be new for 2024. We didn't discontinue any of the plans that we have out there from MEWA for 2023. Gives a little description here of what the preventive RX and the lean RX will actually be. The new preventive RX Plus PPO HSA plans will have a low copays, no deductible for Tier 1 and Tier 2 drugs for common chronic conditions. So you'll have an opportunity to have copays for your Tier 1 and Tier 2 drugs the first dollar for HSA plans versus having to pay the deductible upfront if you choose a plan that has preventive RX Plus in that benefit design. You see here those first two plan designs. It will show you in the name that this is a plan, or these are plans that have preventive RX is actually in the name. It won't be a mystery to you. And then lean RX, the new lower cost lean RX plans allow for low copays for Tier 1 drugs specifically or exclusively. And then you go into 50% co-insurance for all the other tiers. Tiers 2 and tiers 2 through 4, you'll pay 50% for the medication. If you get a group that has a lot of usage in the generics or Tier 1 medications, they'll have a low copay for that Tier 1. And the same thing's true for the ABF as well. All right, so here we go. So here it breaks it down more here. Let's see, we go back one here. All right. Here it is. Okay, so the first section here where it says standard non-HSA PPO, this shows you how our copays look currently for they won't have preventive retail or preventive mail order, preventive RX on a traditional plan, standard plan, but it shows you for retail level one, retail level 2 pharmacies we mentioned earlier, what those were. And then the mail order, what the copays look like for those kinds of plans: 15, 25, 30, 67, 75, 150 for tier 2, and on and on. The next section where it says new non-HSA PPO lean RX, you see on the left-hand side, tier 1. Tier 1, you see a lot lower copay for tier 1 for your generic medications: $5 for level 1, $15 for level 2, mail order $10. And all the other tiers you see there in the red are all 50%. So for a group that's relatively healthy or very healthy, and they don't have a lot of medical or medication uses, rather, not a lot of drug usage, then this may be a good option for that group. But you're taking a risk on the group if you don't know what kind of medications they're taking, because tiers 2 through 4, brand name, non-formulary, and high cost medications of tier 4, they're going to pay half of that cost for the medication. One step down, the last option here is the new HSA PPO with preventive RX. So this gives you an idea of how these plans are going to pay out. For preventive, for tier 1, $5, no deductible. $5 first dollar copay. Tier 1 for mail order, $10, no deductible. And then for the retail, it shows you that it would be, so for the plans that are not preventive, deductible plus $15 for level 1, deductible plus $25 for level 2. And then mail order is deductible plus $30 copays. Tier 2 would be $30 for preventive RX, $75 for mail order, no deductible, first dollar, if you will. And then level 1, deductible plus 60, deductible plus 75 for level 2, and deductible plus 150 for mail order. So it gives you an idea of how they're breaking down those copays for lean RX and preventive RX. We think these are going to be significant going forward in the marketplace because it's going to lower that copay cost, copay responsibility for these plans that are preventive, or if anyone just uses tier 1 medications. So make sure you look in the plan name for preventive RX and lean RX when you're looking at our 2024 plans for these kinds of plan designs. Let's give you an idea here of the legacy plans that are going to have changes this year. Legacy plans, once again, are the grandmothered plans. And there will be some changes to the plans that are being offered. And so if you have a group that has one, that group number that's 00 or 000 as the prefix, those are the quick way to identify a legacy plan, is that group number has a 00 or 000 prefix to it versus the letter prefixes for ACA and MEWA. These groups will, if they can change plans at renewal if it lowers their premium. They can't change a plan and have it be an increase in benefits. You have to lower the benefits or lower the premium, if you will. The red font or the red letter changes here are the ones that are going to be recommended for 2024. The plans on the left-hand side are the ones that are being discontinued. So there's going to be a different spreadsheet you'll have to have in order to sell for a group if they want to change their plan and lower their premium at January 1st for their renewal. They can also, if they have at least 10 enrolled, they can add a second plan if they have at least 10 enrolled, 10 employees, 10 employees that are enrolled in the plan. They can have 2 plan designs or dual options as well. That second plan that they add must also be a lesser plan or a less costly plan. It can't be a more expensive plan. So you need at least 10 for that. There must be at least a 10% spread in between the 2 plan designs that are chosen. So the premium spread, you look at the premium rates. To choose this lesser plan to add, you have to have at least a 10% spread between the plan they currently have and the plan you're looking to add. And there must be at least 2 people on either of the plans that are being offered for dual option. So keep that in mind as well. Medical plan updates for virtual visits with HSA plans. For this year, the deductible would apply. So whatever the cost was for the virtual visit, you'd have to go and pay the deductible up front. For 2024, the deductible will be waived for virtual visits under the ACA plans. Mental health and substance abuse office visits for children under age 19. Right now, the copay applies for 2024. It'll be $0 copay for those focus plans. So for focus plans, in the group name, you'll see the name Focus. So it'll be, Blue Access and the deductible and whatever that plan name is. At the end of that name, you'll see Focus if it's a focus plan. And right now, that means that the dependents that are under age 19 have a $0 primary care physician or PCP copay, $0. But for mental health, substance abuse, the copay applied for those services. Well, for 2024, that will be $0 copay for those services as well as the PCP services. Cellular and gene therapies will be part of human organ transplant. RX home delivery will now have lower multipliers, RX multipliers for 2024. Right now, they're 2.5, 3, and 3. For 2024, it'll be 2.0, 2.5, and 2.5. Level 2 pharmacy copays will be slightly increased for level 2 to encourage greater level 1 pharmacies. So we're looking to get you to use more of those level 1 pharmacies or get our clients to use more of the level 1 pharmacies to get to lower the cost. And Link will no longer be the plan name of the HMO plans that are offered out there. We used to use the name HealthSync and Link, but now we're just going to be using HealthSync only now. For MEWA and ABF plans, same for all of these. Excuse me. RX home delivery is going to be lowered for just the same. The pharmacy copays are a little bit more in detail here. They're going to adjust the retail pharmacy copays to help keep plans affordable and encourage greater use of level 1 pharmacies. So same thing as the ACA we saw earlier there. Small group wellness. The wellness package for ACA and ABF and MEWA will be the Engagement 200 package with Smart Shopper for the HMO. That's the PPO. For the HMO, it's going to be the Engagement Package 200 with EAP Basic only and no Smart Shopper. So they both have EAP Basic, but they don't. The HMO will not have Smart Shopper. What is the Engagement 200 package? It has the incentives for members to get involved with their health experience with Anthem, basically. And it shows you here what the incentives are for the various activities that the member does throughout the year. Digital MasterCard, Anthem, Digital MasterCard, Amazon, Target, Uber, TJ Maxx, Home Depot. Those are going to be your gift cards, and those rewards can be redeemed at the end of the current plan year. This is true for your ACA and your MEWA. They both have those packages, HMO and PPO. Behavioral health features are going to be a part of the small group packages as well. And you can see all those here for utilization management and case management, follow-up after hospitalization, all part of the package for Anthem for 2024. We're changing we're changing Future Moms plan. We're replacing that with Building Healthy Families in 2024. It's an expanded digital member experience that's going to be on the Sydney app with an ovulation fertility tracker, fertility content and education, due date calculator. You can monitor the baby, all that through using the Sydney app and setting everything up from that. So that's going to be an improvement on the Future Moms program. Once again, this shows you the transition from Future Moms to Building Healthy Families and how it's expanding out the services that are going to be available to those families. Anthem Specialty. So the updates here, there's going to be a new dental enhancement coming January 2024, new Dentures at Home program. There's going to be Ortho Home, which will provide teeth straightening with clear aligners at home. Teledentistry offers virtual care dental services, including problem-focused exams and referrals or virtual care for dental emergencies. So that's going to be another change for Anthem Specialty, and a new vision discount prescription eye drop program for myopia and dry eyes launched for small groups on July 1st, 2023. So that's going to be another one as well that we're looking to add to the specialty programs. If you have any groups that have standalone dental on the small group plan, so they don't have medical, they just have a standalone dental plan, that's all they have with Anthem. These are very rare, but that is being discontinued. So we're going to discontinue the small group ACA standalone dental plan that was offered as exchange certified plan. That will be in 1/1/2024. The members can choose a different plan, the different essentials choice plan. They can choose an individual plan, or they can also opt for a medical plan that offers dental services for adults as well. Not a lot of these plans, but for those who have clients that have them, they should be aware that they're going to be changed to a different plan design. Anthem Life is being acquired through it's not really a merger, I guess it's more like an acquisition with this by the Standard. And many of your clients have gotten letters and updates about this. We're moving the groups over in batches according to their renewal date. And so this is going to be this merger, this acquisition isn't actually final until the first quarter of 2024, but they're starting the process. They're starting the process now of getting the groups over. And some of the groups are experiencing a blackout period right now where the transition is taking place. And because of that, versus having some weird looking numbers and data out there on the website, they just black everything out so the members can't see anything. The employers can't see anything right now until this is all completed. So you'll be getting updates about this transition to the Standard from Anthem Life over time. Many of you probably already have gotten information from that. So this is an ongoing process. If you need more information on that, of course, we have websites that you can go to, or email addresses you can actually go to as well, where you can ask questions about the transitions from Anthem Life to the Standard. One more thing here about the Sydney app is that it's a highly rated app, 4.8 stars for Sydney, for an app in general, with the public freely being asked what your opinion of it is. They can bash it, they can say it's great, whatever. They have the opportunity to do either. This is a very popular app. 4.8 score is quite outstanding. 15 million, over 15 million registered users, and most people use the Sydney app for claims information. So most of the app's usage, if you will, is for claims usage, to find out what the claims information is for those clients. Also, finding care is number 2, looking for who your providers are in the area. ID card is number 3, because it's a exact image of your card front and back on the Sydney app. So that's number 3. The benefits that you have for your employer or that you have through the Anthem individual. And then health and wellness programs are the 5th top reason why Sydney is used. So we're basically putting a lot of effort into the Sydney app because it's using AI, it's using just traditional information to be all placed out there for you to find it on your own, or to use the AI assistance to help you find it. Either way, it's there for you. And so encourage your clients to use the Sydney app if you would, please, because it's a very big differentiator in the marketplace. The Sydney app is not like any other app for this purpose in the marketplace. It's a differentiator. It's a difference maker. So any questions about Sydney, once again, let me know, and we can get you some more information about that Sydney app. Broker Launchpad is here. So if you go to the Broker Launchpad, you'll be able to use the services that are out there for you. It's a simple path to find what you need through your broker hub, your producer toolbox, and to get what you need, because we've got a lot of information out there. And so to help you to find what you need and to more concisely use what's out there, the Broker Launchpad is going to be a good way to actually go about doing that. There's a small group broker bonus program that's going to run from November 1st, 2023 to March 1st, 2024. So here are the details of that. The points you can earn for new sales made as you're a part of the program. So for MEWA 10 points, ACA 10 points, ABF 10 points, Association PEO 3, and HealthSync 3 points. So the more you sell, the more points you get. Individual broker bonus program is coming soon. We don't have the details on that quite yet. And basically, yeah, that is the full presentation we have. This is basically the presentation that we had for the Fall Broker Roadshow. So if you were in attendance of the Fall Broker Roadshow, then you've seen it once again. If you were not, this is what we went over, and you are all caught up to date as things stand now. So if you have any questions, type those out. We can get them answered. And but I thoroughly appreciate you joining today, and let's get busy. Thank you.
I see no questions, but we can wait a few minutes.
Okay.
Just in case someone's typing it.
Yeah. Oh, good. Thank you.
Again, I see no questions, so I want to thank you everyone for joining us, and Arnold Saunders of Anthem Indiana for being the presenter. So thank you very much, and we will end our webinar today. Thank you.
Thank you all. Have a great day. Thank you. Bye-bye.
Thank you.